Hi, this is Sally Flashberger with the Wisconsin Board for People with Developmental Disabilities. We are here today with another Living Well Wednesday. We're doing something a little bit different today. We are actually going to be talking about a kids issue. So we're going to be talking about special education during COVID, because we know it's been a stressful time for all. If you're joining us on Facebook Live, please leave any questions or comments in the chat, and also on the Zoom, you can put any questions in the chat. So we're really excited to have a lot of people with us today. We have Phyllis from Disability Rights Wisconsin joining us. She's an advocate. We also will hear from Daniel Parker. He's one of the assistant special ed directors at the Department of Public Instruction. And then we have 4 parents with us who are going to talk about their experiences. We have Cheryl, 2 Annas, and Christian. So it's going to be a packed session. And I'm going to turn it over to Phyllis. I'm just going to get her PowerPoint up, maybe. I don't see it on my, hang on. Oh, no.
If you can't get it up, I can share it. You just have to make me a...
Yeah, I don't know why it's not.
What?
Hang on. I'm going to let you share it. I don't know why it's not popping up. Hang on.
All right, that'll just take me 1 second.
All right. All right, it made you a co-host.
Okay, give me a second. I'll pull it up. All right.
I can give it a try again if you want me to.
I think I got it now. I just have to share my screen. Sorry, guys. Hi, I'm Phyllis Greenberger, and I'm technically challenged. All right, share screen. Here we go. Can you see my PowerPoint?
Yes, we can see it.
Okay. I think... Okay.
Perfect.
All right. Hi. So I'm Phyllis Greenberger. I'm an advocate, lead advocate at Disability Rights Wisconsin. I work out of our Madison office. And I just thought I'd do a real brief overview of what disability, who we are and what we do. So who are we? So we're a private nonprofit agency. There's one in every state for protection advocacy in every state. And we are supposed to ensure the rights of all citizens with disabilities through individual advocacy and systems change. And as I said, we're part of this national federally mandated system of independent protection and advocacy agencies for people with disabilities. So here you can see our vision, which is that all people with disabilities and their families shall be empowered to exercise and enjoy the full extent of their rights and to pursue the greatest possible quality of life. So how do we try to do that? First of all, we serve people of all ages, including people with developmental disabilities, people with mental illness, physical or sensory disabilities, people with traumatic brain injuries. So really, we cover the gamut of all types of disabilities as well as all ages. I work with children, but other people work with adults too. And when I say children, in the special education advocacy, that's through the end of school, so that can be through 21. And we do that in a variety of ways. So I thought it'd be interesting for people to just know that, because sometimes people think we only do individual advocacy or we only do systems advocacy, but we actually do a variety of things. We do the individual advocacy, helping families navigate special education. We go to IEP meetings and do a variety of other things under individual advocacy. I'll talk a little bit more about that in a minute. We also do systems advocacy and public policy kinds of things under that. We do training. We present webinars like this, but we do lots of other trainings. And we also do legal support for families. In addition to our protection and advocacy, we have some other programs. So we do have the Ombudsman for Family Care and IRIS and some other things. I won't go into much detail about that because that's not what we're talking about today. So what do we do in special education? So we do a variety of things, from direct involvement to just giving information on the phone. So if parents call us, we do provide information on what their rights are and what the students' rights are, including helping parents strategize about IEP development and services. So that might just be on the phone. We do also attend IEP meetings. Some of our priorities have been school exclusion. We think of that broadly: shortened days, suspensions, expulsions, etc. We also have another one of our priorities is seclusion and restraint. We take individual cases on that in schools. And the new one, of course, for everybody this last year is COVID issues. So we have worked on a variety of COVID issues, both at the individual level and systems level. Just to give you some examples of what we've been getting calls about. So we've been getting calls about schools we didn't get as many calls in the spring. I think everybody was taking, everybody was like, oh my goodness, what are we going to do? And was all, sort of caught up in figuring all that out. But starting this summer, we did start getting more calls. And we've gotten a number of calls from families who are saying, my child can't learn virtually and my school is going 100% virtual. What can I do? And we've gotten calls about mask issues. My child can't wear a mask. My child has somebody in their class that can't wear a mask, and my child has health issues. I'm worried about that. We've gotten calls about my child usually has an aide to help them be included, and now because part of it's virtual and that aide's not available, my child doesn't really participate in the virtual. And so we've gotten calls about those kinds of things regarding like least restrictive environment. We've gotten calls about my child didn't really get anything in the spring, and so Daniel might talk about this, but DPI has put out in a bulletin on additional services to deal with that if students really lost a lot in the spring, and how to kind of deal with that this year. So those are just examples of some of the things that we've been getting calls about. So another thing that we do besides the individual calls and helping individual families problem solve, or like I said, go to IEP meetings, at this point mostly virtually, we also participate in systems issues. So we do that by being on statewide committees, advocating with various state agencies. So DRW has been meeting with people at DPI around some of these COVID issues to kind of collaborate and work together on some of that. We do education for policymakers, work with the legislature, and we team up with other advocacy agencies like BPDD to try to influence public policy. I just thought it would be interesting for you to see some of the systems issues. In the last several years, we've worked on seclusion and restraint law in schools, which Sally worked very hard on when she worked at DRW. Trauma-informed practices is another systems issue we've worked on. We've been, like I said, having meetings with DPI and other agencies advocating for educational rights during COVID, and working on giving feedback on some of the things that DPI is putting out. We've worked with some national organizations on some of the educational rights during COVID. And then we are on a variety of committees representing advocacy point of view. And here's this is our website, so you can get more information there. And if people have individual questions for me that we don't get to today, you're welcome to call that number, 267-0214, and ask for me. Our phones are being answered and then forwarded to each of us. Sally also asked me to talk a little bit about what can families expect. And I think the main thing is that special education law, which is IDEA, Individuals with Disabilities Education Act, is still in effect even though there's COVID. So what families can expect is a free, appropriate public education, which is what the student is entitled to under IDEA, but with precautions for COVID. So it's very hard to answer sort of what can you expect in a global sense, because what IDEA says is that everything is individualized through that individual education program, or the IEP. So and she also asked me to talk about some strategies. And so what we've been recommending is that if people are struggling with how to do whatever it is their school's doing, hybrid, virtual, in person, because it's all over the map right now, and that may change, it might come and go, some schools that are virtual might open, some schools that are open might go virtual or hybrid, who knows. So really the biggest advocacy strategy is to ask for an IEP meeting to talk about the things that are going well, and to talk about what additional things are not going well and you need help with, to look at the goals to see if you're making progress toward those goals. So again, everything really is individualized, and that IEP meeting is the best place to discuss those. And you're looking again at just the things you always look at in special ed. Is the student able to make progress in the general ed curriculum, and are they making progress toward their individual IEP goals? So that's kind of the things that I had hoped to cover in my short introduction. I think we're going to take questions later, right, Sally?
We try to take them usually as we go, like with
Okay.
the person. But I just have a couple questions, and I think even this came from the conversation with some of the parents who are going to be presenting. So so a lot of parents want to plan for like what happens if this changes. You know, so say you're virtual now, but then you're going to school, and I think, you know, just worried about not planning for the future. And how maybe have you been telling people to deal with that? Or, you know, because thinking like, well, shouldn't we put a plan in the IEP now, or what could happen?
So I think it's a little bit tricky, because you're planning for what you have now. I think it is perfectly fine to have a discussion at an IEP meeting regarding if my school situation changes. And we've gotten more calls about this for schools that are in person, that someone's worried it will go virtual because it's a student who didn't learn well in virtual in the spring. So so the IEP should be planned for in person if that's what's happening right now. However, I think it's perfectly fine at that IEP meeting, when you plan the in-person, your goals may not change. The question is, can we have a discussion, please, about what it might look like if you do end up having to go virtually quickly? Because we didn't have that opportunity in the spring. So you can have a new IEP meeting when you go virtual, but you can also certainly have a discussion now about, this are some additional services I think my child might need to reach those goals if the situation changes. So we've been encouraging parents to go ahead and bring that up and have a discussion about it. They may not add the services right now because they're not needed. You might need to meet again to quickly add some kind of service if the situation changes and that changes the services. It may not change the IEP goals, because the goals are really for your student for the whole year. So it's more about, I think, the services, and it's perfectly fine to ask to have that conversation. But regardless of whether it's what happens if we move from in-person to virtual, or virtual to in-person, or hybrid, it's fine to kind of, it's not a surprise now, is what I'm saying to parents. Is in the spring, it was an absolute surprise. Parents were caught off guard, schools were caught off guard. We were all caught off guard, right? But now it's not a surprise. We know that this could happen, and so it's just planning and to have that discussion.
I think
Does that answer your question, Sally?
Yes, and I think another question, and maybe Daniel will talk to this a little bit too, but I think the question always is too, like, how long is too long to wait for an IEP. So if a parent says, I want an IEP meeting, just given everything that's going on, what can they expect? What is a reasonable expectation of when they can get that IEP done?
Am I muted? Okay. So that is a hard question all of the time, not just during COVID. That's not different during COVID. IDEA doesn't have a time frame. If you ask for an IEP, you must have it in 2 days or whatever. It's a reasonable time. So I often suggest that parents request that in writing. So, through an email, it doesn't have to be a letter, but just through an email so that they have response. And if you're asking for it from the teacher and a number of days go by and you haven't heard anything, then you can ratchet that up and call, contact the special ed director saying, I already asked for this, I'm asking for an IEP meeting. But the law doesn't give you a time frame, but it is reasonable. And I think, I can't give you a number, but you should hear back pretty quickly that the person at least is trying to plan something. It may take a little bit of time to get it planned, but yeah, I don't know if Daniel, you have a more direct answer, but.
Well, and that's a great segue to Daniel. So Phyllis, if you can stop sharing, I don't think I can stop your sharing. But I'm gonna turn it over to Daniel Parker. We're happy to have him with us. He's one of the assistant special ed directors at DPI. So excited to hear from him. Excellent.
Hey everybody. I am going to share my screen now. And so click here. Can you see that okay?
Yep, looks good.
All right. So I'm Daniel Parker. I'm one of the assistant directors of special education at the Department of Public Instruction. Just want to say right now, this is just such a difficult time for everyone. It's just incredible. At DPI, we have an equity vision and mission that I have on the screen. I think of this as that students get what they need, when they need it, and especially in the way they need it. And that is so complicated right now. There are so much going on in our communities right now. Not only due to COVID-19, but also due to the police shootings and the deaths of Black people in our society and the emotions that go along with all of that. So this is a very complicated time, and equity and thinking about these things cannot be more important as we kind of talk about some of the guidance that we put out through DPI. I will say that DPI, we have a COVID-19 webpage, lots of great information. If I was a first-time user there is information for parents. There is a little section there, but I would really look at the special education section. I would also look at what's called the pupil services section, which has a lot of the mental health supports. There's so many great documents on supporting mental health of students from our student services team. And there's also some information for families as well that they've developed. As you know, we put out education forward guidance for schools around school operations during a pandemic, but there's a link to that special education COVID-19 webpage. And then we also have some supplemental special education COVID-19 resources. So we've linked to, some of the autism societies, national organizations for different groups of students with different needs have put out some really good information on supporting students with special needs right now. And we actually created a supplemental page that really gets into some of that national organization guidance that might be helpful too, because there's just so many people thinking about these issues right now. I do want to, won't go through everything. We talked a little bit about additional services, and I'll get into that specifically what that means. But I just want to point out that our Wisconsin Statewide Parent Educator Initiative, as well as many other family support and advocacy organizations, Disability Rights Wisconsin gave us some great feedback on an earlier draft, and thank you. We put together a for families version on what additional services mean, and that was at the suggestion of Wisconsin FAST, that's our Parent Training Information Center, and really appreciated being a part of that work. But there's some good information to kind of deconstruct some of these complicated discussions for families. So I just wanted to share that with you. And here, there's also, if you have children who are getting teleservices like speech and language OT or PT, we actually created a new web page with teleservice resources, and we're updating that regularly with new modules and information. We also have a document called Considerations in Using Facial Coverings. Not surprisingly, facial coverings have to be in the top 10, if not top 5 questions we're getting at DPI. There's so many complexities about students who have, sensory needs or different types of needs that really have difficulty using facial coverings. At the same time, because of public health, we know that the science and the county and our state health departments have said that facial coverings are absolutely something that should be utilized if you're going to have in-person instruction. So it's obviously a very complex topic. A couple things I just want to point out about facial coverings. This document really, and the intention was to really get into some resources and considerations to support students who might have unique needs and thinking through how to support them in using facial coverings. There's so many great tools through visual supports and video modeling. I know some of the autism societies have put out some resources to help students. But we have students who have 2 minutes ability to use facial coverings, tolerance. And so, that's complicated. So you have to be really creative in thinking of different pieces around that. But one of the things I would just point out, if you have schools or districts that have requirements of like doctor's notes or orders, we are going to update our frequently asked questions document on the special education team webpage, probably this week or next week, with a new FAQ around this. Certainly an IEP meeting can be utilized to provide supports and accommodations for students around facial coverings, and IEP discussion should be occurring to support unique needs of individual students on what is going to work best for them in that situation. A couple other pieces, and I'm going to drop this document in the chat. And really quick, Sally, how much time do I have?
Another 5, 6 minutes.
Perfect. Great. And then I can take some questions if needed, and hang on. This is the special education question and answer document I was referring to. We update this almost weekly, and it's really nicely organized into different sections. I'll even just show it really quick here. If you look at this, there's a whole foreword that kind of talks about what we think is most important during this time. And that is that, unlike the spring when all this caught us by surprise, districts and IEP teams and schools and families should know right now, free and appropriate public education needs to be provided to students right now in the least restrictive environment. We need to make sure IEPs are being implemented as written. And if the IEP cannot be implemented, moving to a virtual learning environment or socially distanced or a change in the schedule, there needs to be a revision with a contingency plan or a revision to the IEP. And the contingency plan is part of the IEP that explains how the student is going to receive a free and appropriate public education, meaning how is the student going to receive special education services so that they can make progress on their IEP goals, as well as make progress in the general education curriculum. Really quickly, you can see that we've got with the documents gotten so long that we've just kind of have all of these different kind of sections here. So hopefully that there's lots of great information in this document, and it is being updated regularly. Another key feature of ensuring IEPs are being implemented is progress monitoring is critically important right now. We need to know where students are. coming back from, especially those students who may not have received any special education services or general education services in the spring. We need to know where they are in their present levels, academically and functionally, all those mental health, social, emotional skills, daily living skills, all of that functional support and skills. We want to know where students are. We want to know, look at their IEP goals and their current IEP and look at, how much progress has been made. And we need to be looking at our current structure for general education, special education supports, and really look at the IEP, those disability related needs, those IEP goals and services, and just kind of consider, can this be implemented as written? And if not, we need to make those changes. And it's different for every single student. Every student is unique. Every district and school is somewhat unique in how they're handling the pandemic. So it's really important to have these discussions between families and students. A couple other things. Individuals Disability Education Act, the legal requirements around timelines have not been waived. You can, for evaluations and child find requirements of districts identifying students, reviews of existing data can be done virtually. There are possible ways to do some types of information gathering and testing in either in person or virtually. One of the themes that we've talked about is, even if a district has gone all virtual, there's nothing that says from any public health order that we are aware of, and there have been adjustments to some of the public health orders, that for some students based individually, that they might be able to receive some in-person instruction. That doesn't mean all students with all IEPs all day in person. It doesn't mean all students with one type of disability label in person. But it's an individualized decision based on whether the IEP can be implemented as written. And if you move to virtual instruction, what is going to work, what's not going to work, what changes can we make to make it work better. But then there's always that option that IEP teams to have to say, what possibilities are there for some in-person instruction for things, so that we can make progress on those IEP goals and we can make progress in that general education curriculum. So that's really an individualized discussion. And that also applies to evaluations. We do have some nice webinar and conducting virtual IEP team meetings. Wisconsin Facets helped us out with that one as well. And there's some good national resources, and we have a whole website dedicated to virtual IEP meetings that I would strongly recommend taking a look at. We still are looking at least restrictive environment, and we know that gets tricky with virtual learning environments and how that can work. And I am still learning at the innovations folks are making around, a special education teacher being in a breakout room with a student, or a paraprofessional being in a breakout room, or a paraprofessional being on the phone with a student to help them engage during a virtual lesson. There's lots of creativity and interesting ways people are working around thinking about placement. The additional services guidance I already talked to you about. One thing that just I would point out, additional services is looking at what did students, from the spring, where are students and what additional services might they need because of a lack of instruction or a lack of effectiveness in instruction in the spring. For some students, just determining what's going to work right now is the priority, right? But one of the things I would like to point out is additional services. A component of additional services is also thinking, if you move to a virtual learning environment, you might need additional supplementary aids and services, additional accommodations, such as assistive technology. You might need different program modifications and supports for school staff, which is a part of the IEP. So you might need additional training for staff on how to do something, right? Or additional support for families that they might need, that needs to be written into the IEP. So some of these conversations about implementing the IEP as written and getting that documented, and that can also be documented outside of an IEP meeting through what's called an I-10 form. And that I-10 form does require that the parent agrees with the services. But a lot of these discussions, whether they're about additional services or about implementing the IEP as written, really also have this intersection of thinking about what is different in the learning environment and what additional supports might be needed. And that could even lead to a new IEP goal or new services, or an identification of new needs around trauma or social emotional needs. I'm not going to get into too much of the additional services guidance just because of time, but I would guide you to that for families version. It really deconstructs the bulletin. That's the legal kind of more technical language and breaks it apart while it's still consistent with the bulletin. Couple other things I just want to say as we go through here is that parents have those dispute resolution options. I think Phyllis mentioned them earlier. Throughout all of this, you know, we want families and schools to be working together to problem solve, meet families where they're at, recognize that families are going to be at different places. If they're anything like the staff I'm supporting with young children, they're going to be at different places on different days right now, different weeks. And schools are going in and out of decisions on how they're supporting students. So, you know, we just got to, you know, we got to be in constant communication. I've also heard, if schools are listening, you really got to talk to the family on how much communication they want, because some families are also like, just give me a breath. So talk to families, what communication is working best for them, when's the best time to reach them, having those types of conversations. But all of the dispute resolution options that are always available are available right now. Our Wisconsin Special Education Mediation System is able to do their work virtually. So they can do some of that support virtually. And families do have those options for state complaints and due process hearings as well. Couple just resources to mention. We have a public forum. We would love to hear what the experiences are of families right now. We do this every year through our Special Education Council, and I'll drop this information in the chat. There's going to be an online, in-person, virtual commenting time on October 14th, and you can sign up to comment, and there's a link. There's also, if you're not comfortable talking publicly, we can also solicit comments through a form that people can just write their comments. And we have English and Spanish versions of that, and there's more information on the council page. Every other week, DPI has a community of practice for educators, and we have invited families and others to this as well, and other stakeholders in education, just to learn about various topics. There's a flyer and information on the DPI Special Education Professional Learning Events page, and I'll put that in the chat as well. But we have had topics on facial coverings and teleservice. We'll have ones on paraprofessionals coming up. We have one on students with medical fragility coming up this Monday. So we do them every other week. We also are starting a new community of practice just for related service providers that will be coming out. And there's information on that. There's a great project. There's been a lot of federal investment in states to handle this pandemic, and states have, some of that money has gone to DPI. And although a lot of our supports go directly to districts, we set aside some funding from our federal CARES Act, and we were able to do some additional projects. And one of them is Universal Design for Learning. And on the DPI UDL webpage, they have these great, if you have students that are fairly independent with technology, but just need that kind of motivating engagement factor, they're talking about all this virtual kind of just tips and programs and platforms to help engage learners in their learning. And this is for students with and without IEPs. So they have, and they're going to have a virtual conference as well. Another project is called Assistive Technology Forward, also funded by this CARES Act funding. We haven't started that yet, but look for it on the Assistive Technology DPI page. And we're going to start this community of practice, and the focus is on families. The focus is on supporting families, being able to support the assistive technology needs of students at home. And it's going to be this community of practice of educators and others in the community and families talking about assistive technology issues, things like augmentative communication systems for students that don't use verbal language, but everything to like different apps and platforms to help engage learners in their learning. So those are those. Sorry, I went fast. I'll drop some of these in the chat now and stop sharing my screen.
All right, so we did have several people want to know if you'll share your PowerPoint. So
Yes.
you can send it to me and I'll get it out to people who registered, and we can post it on our Facebook page also. And then there was one question, you had talked about contingency plans and wondering if that is considered a change of placement.
So a contingency plan, I'll drop these in the chat when I stop talking here. I apologize, I should have done that before I started talking. So a contingency plan is a revision to the IEP. It states the contingency of what happens, like when students are in this when the district moves to virtual learning, this is what FAPE or the IEP services will look like. When we're in person, this is what it's going to look like.
Okay.
So it's kind of a contingency for situations. That contingency plan has to outline the services a student will get. And as you may know, there's 4 parts to services. There's the frequency, duration, amount, and location of the service. So that frequency, duration, location, and amount has to be included in the contingency plan. And the contingency plan is not separate from an IEP, it's part of an IEP. You could also do that just you could just revise the IEP, but I think we usually recommend contingency plans because that way you can kind of have the IEP as written, and then here's what it'll look like in these different learning environments.
Yeah, I think that's a great suggestion because especially for schools that might close for a short period of time and then reopen, I think, we may see this bouncing back and forth. So
absolutely.
I don't see any other questions. I'm looking at the Facebook too, but all right. Great. Daniel, just a wealth of information. You guys have done so much work. This used to be my former life was this, and I just can't imagine how you guys have been cranking out the information. So
not a dull day.
That, and I think all these resources that people might not know about are great. So at this point, I'm going to turn it over. We're going to hear from Cheryl first. We're running a little behind, but parents, if you want to think about 5 minutes, I think we'll get it all in 5-7 minutes. We might run a little over, but I'm going to turn it over to Cheryl to talk about her experience in Germantown.
Thank you, Sally, and Phyllis and Daniel as well. Thank you so much for sharing and for your guidance. I'm a parent of 3 children, and my youngest is a first grader. He's 7 years old, and we're in Germantown School District. He has Down syndrome, hearing loss, speech and language delays, and a health impairment that it's called anhydrosis, and it means that he is unable to regulate his body temperature. So we have to do it for him artificially, both cool him and warm him. This year, elementary students in Germantown were given the option to go fully virtual or in person 5 days a week, full days. And so our family opted for our kids to go full days. And so Quincy is currently with his class, and the class size is smaller this year, which works out really well for social distancing. He is a kid who is in the general ed classroom most of the day. I would say if pullouts were averaged out over the week, he maybe is pulled out for about an hour each day for OT, PT, speech, to meet with his teacher of the deaf and hard of hearing, and also some special ed support. He has an aide for academic support as well as a full-time sign language interpreter. And so because of his specially designed instruction outlined in his IEP and related services, virtual learning was very difficult for him last fall. But the teachers certainly bent over backwards to find creative ways to help meet his needs. We are very grateful that he is able to be in person this year, and that has been an option for him. Some of the hurdles, so we're 2 full weeks in now, and some of the hurdles are still lip reading, for our students that are deaf and hard of hearing, and what that might look like when you're surrounded by those wearing masks, as well as sound quality when those around you are also wearing masks. That makes learning more difficult. And then temperature regulation is another one that's really tricky. As we all know, we sweat underneath our masks, and for a young child who's essentially nonverbal and unable to take his mask off, it is really difficult when you can't sweat under a mask in a room that's not air conditioned. But thankfully, his aide, who provides academic support, is also helping him medically to assist. We did meet as a IEP team right before the school year started, so in late August, and made a few revisions. We did not add a contingency plan at that point, but it is forthcoming. We did, and I want to share this resource because it was really helpful for us, is we brought in the coordinator of the school intervention team at Children's Hospital. So through Herma Heart Institute, there is an interventionist. Her name is Kyle Landry, and she works with us to help support and teach our team. She did this last August about the medical needs of Quincy and how we can accommodate him. And it's especially important this year because of the mask wearing. And it's tricky, especially tricky when you can't read facial cues and you don't want to get within 6 feet. And so there's additional difficulties to manage him medically this year, but she was an excellent resource that zoomed into our IEP meeting and really spoke from the medical perspective, which was very helpful for our team. And then lastly, one other thing that Sally had asked me to share was something that I found very helpful is to be a part of the Special Ed Parent Advisory Committee in our district. And that has been an excellent way to receive and share information at the local level. And additionally to work at the state level on the Parent Advisory Committee under the DPI State Superintendent. So those are ways for me as a parent to be in the know and to share what's working and what's not working, in addition to forums like this.
Excellent. Thank you so much. That was perfect, Cheryl. All right, I'm going to turn it over to Anna Stevens to share her experience so far.
All right. Hi, my name is Anna Stevens. My child attends school in the Madison Public Schools. Xavier is 15 years old. He has cerebral palsy, and his version means that his body is fully affected. So he requires, somebody to move him and do all those things. And he's also a nonverbal person. So we really struggled in the spring. I know everybody did, but basically when everything happened, we lost school. I think that was a really big challenge for everybody, but school is really not, it's really hard to meet the needs of somebody who can't tell you what they need and get them to interact with you. When you ask questions, even from like our special ed part where it's like, hey, tell me what you think about this. And it just became overwhelming. And we didn't have any regular ed, and that's something we normally have. In Xavier's normal life, like in like the day-to-day, like Xavier's very on the go. He's, from classroom to classroom, he's always kind of moving around. And so that's what in-person usually looks like for him. When we got to spring, it wasn't like that. And we ended up kind of just holding on for dear life like everybody else. And we just, we just showed up to a meeting. We mercifully had a teacher who held like a, kind of a group meeting. It was, math class was just kind of a get together where students could just kind of unwind because he was like massively depressed. I hadn't realized until we started having those meetings that he was so depressed until I heard him laugh one day, and I realized how long it had been since I heard him laugh. And that was really hard. And that actually drove our decision to choose to do an extended school year over the summer. We did that virtually as well. And so when we were going into the fall, we just weren't really sure what to expect. And we are amazingly surprised at what we have this in the fall versus what we had in the spring. It just, even versus summer, we had our IEP virtually, just like a lot of people did. And that went really well. I actually almost like it better. I have 3 kids, and so getting to an IEP can be really challenging. Like I have gone to IEPs throughout the years with little kids running around screaming during the IEP because I had no other choice. It's just me and 3 kids. So, just having that was amazing. Right now, what we're doing is virtual. We have the option for in-person. Our district is doing a thing where each student kind of gets approved for what most appropriately meets their needs. And for us, that means 2 days a week, 2 hours at each of those visits. And then each kid is kind of zoned out in their little areas. Right now, we're not implementing that. We have some difficulty with transportation that we're working out. I have concerns about transportation where, keeping him safe, especially because they're strangers, and we haven't had a great relationship with making sure that he's safe. And so just not knowing that, we're not comfortable, and we're moving forward with it, I think, for probably October. And that will help too, because he also doesn't temperature regulate. And most of our building is just, it's not air conditioned. They're working on it, but it's not there yet. And so he gets really hot, and with a mask on, he's a person who can tolerate a mask, but doesn't really function with a mask. And so I'm not super sure how that's going to play out when we get to that in-person place. I have concerns about it, but my biggest concerns are about students around him that can't wear masks, not because I don't think that they should be able to go to school, but because my child has respiratory concerns. And if he gets COVID, he's one of those kids who's really not likely to come out the other side of it. He just, it's a really hard reality, but it presents another concern for us is that right now, like it's just special ed kids who are going in person in our district. So what happens when we start putting other kids back in the building? Do we lock him up in a room with other students? There's really not a lot of space for that. And is he getting meaningful education during that? That's just really not a thing that I think that we will see him getting if we get back to that point. So we have to I think that one of the things that really helped was actually that discussion of a contingency plan. It kind of got my wheels cranking and saying, I really should have a conversation with my team about what is our contingency plan for when we get to this point, because that is something we want to be ready for. We want to say, what are we doing when we get to that point? I'm trying to just one second. So when we had our IEP, the other thing that we're kind of trying to manage is we have staff who also are unable to, for health reasons. So that's a concern too, is trying to figure out how to manage for staff who are being told that on our team, who are being told that they have to show up or lose their job, basically, if you can't do your job, you can't be here. And we've tried to go out of our way to kind of have that conversation and say, hey, we can be flexible here. They're important to us too. We need our, they're people and we value their lives. And, if we need to have classes outside or we need to do whatever, we're just going to be super flexible. But I think overall, if there has to be a really positive part of this, one of the best things that came out of this situation for us as a family was, my child's in high school. So by the time your kid gets to high school, most parents, it's a developmentally appropriate thing. You're not as involved because they're supposed to be doing things more on their own, which is kind of challenging to know what's going on when your child is nonverbal. But we really got the opportunity through COVID to really understand more about the things that we could find for our child, for my child. I say we a lot for somebody who does things myself. But I just got the opportunity to learn, about guided audio and different, all sorts of super amazing things, and the way that my child interacts with his learning. So I could come back to our team and say, hey, I'd like to really see this modified this way. I see how you're doing it, but I see maybe you're asking these questions, but I don't want you to modify the content. You don't need to dumb it down. I just need you to bring it so the assignment is something that he can interact with as a person who's nonverbal. Now, this year's really great for our family. We're really excited. Xavier got an eye gaze device, and so he now has AAC. He's 15, and this is the first time he's really effectively been able to communicate. So that really changed our IEP, and it really changed how things are going. It's still not something that really gets supported virtually at all. It's pretty much all me. He needs me to sit there with him, both to kind of guide him through as he gets tired, or because he's learning how to talk. He's learning how to use his eyes in a whole new way, or to make sure just make sure that he's actually getting to engage. So he gets that independence, and we're really, really excited about it. But we don't get a lot of support where that gets, because we can't. There's not really a great way to be like, could you reposition him when you're not in my house? That's not really something you can do. But yeah,
that's great. Yep. I like too the positive of you learned, like you said, you learned more about his learning and you're able to now share back. I mean, I think that'll make you a continued great partner with the school in telling them how the best to educate him. Because, parents are the experts, just so you know. Yeah. All right, I'm going to turn it over to Anna Moffett, and we're going to hear about her experience.
All right. Can you hear me okay, Sally?
Yep, all good.
Can you hear me? Okay,
yeah.
Great, excellent. So my son is 13 years old. He is in 7th grade at Cherokee Heights Middle School in the Madison School District. He is on the autism spectrum. He has very limited verbal communication, typically 1 to 2 word phrases, pretty significant sensory differences. He also has some respiratory issues, underlying health concerns. He requires pretty much one-on-one support, supervision, helping with daily cares, toileting, that type of stuff. But he's super joyful, funny, happy, loving, smart, which is awesome. Last year, just like everybody else, we went virtual very quickly. That was not successful for Felix. He has a very hard time with eye-hand coordination, and then he's very relationship-based, so not having somebody there to help him through the activities was very difficult for him. But just like everybody else, we kind of just fought our way through it because that was our only option at the time. But going into this school year, I knew that virtual was not going to be the appropriate placement for him. So in the summer, I did send an email out right away to his teachers just asking, what's the plan for the fall? You were all there. This really isn't working. We're seeing a lot of behavioral escalations with the online learning. So we did meet in early summer, early August, and sat down. And so right now, Felix is doing in-person instruction 2 hours a day at his middle school, 4 days a week. He's working with his aide, he's working with the speech and language therapist, and he's working with the occupational therapist. It's only him and one other student, so that's 2 students out of 600 students that are receiving in-person instruction at this time. He is super happy about it and loves it. So we're happy that he's getting that opportunity back in his school, because that was such a big part of his life. And I'm sure other families can relate. For a lot of kids on the spectrum, routine and schedules are really kind of like what holds their days together and their timing. And so when that kind of all went away, it was really disruptive for him and just increased his anxiety because of the uncertainty. So he's going in. He is provided transportation. We'll have to see how that goes, just because he is a kid who doesn't wear a mask and is very sensory, tactile into things. And so I'm a little concerned with him being on a bus, especially if he's going to be sharing that bus with another student, just because, I don't want the other student to be exposed because Felix will not wear a mask during that time. Things have gone well. I think, just there is some uncertainty about if and when other students come back. We'll kind of have to discuss that more, just because he will be a risk in a setting with other kids because of his inability to wear a mask and just some other behaviors that he has that put him at higher risk for contracting something like COVID. But I'm really at a place where I'm just going to cross that bridge when I come to it, because we just don't know what's going on. So I kind of am just going day by day, and we're fortunate to have a really supportive team around Felix that, really don't just want what's appropriate for him, but actually really wants what's best for him, and they're very committed to him and his education.
Excellent. Thank you so much, Anna. And I'm going to turn it over to Christiane to talk about her experience.
Hi, I'm Christiane Olson. Thanks, Sally, for inviting me to share today. We're in the unique circumstance of having moved from Whitefish Bay Public Schools near Milwaukee to Madison Public Schools in June. And it's been a very challenging circumstance. Our child has received supports and services for the past decade. She's now, in the middle part of elementary school. And she's always been fully included in the regular education classroom. And so in the spring, when everything transitioned to virtual, we kind of waited to see what supports and services would be available. She typically receives occupational therapy, physical therapy, speech. She has a deaf and hard of hearing teacher. And initially, for the first several weeks, school was not reinitiated in Whitefish Bay. And then when they did go back, it was really without supports and services. And so ultimately, I took a leave of my job to support her in accessing the virtual classroom. And so in March, when we knew that we would be moving to Madison, we visited the elementary school that she was to attend and talked to the team. This was pre-pandemic, about what her needs were and what they could anticipate for the fall. And unfortunately, you know, her supports and services still aren't in place. She's part of a virtual classroom, and she does have a team established with all of the various people who normally comprise her team, but we've met with them to date 3 times, and they still haven't been able to decide how they will implement her IEP. We have requested that she have in-person supports and services, but the team has not been able to make a decision to date. And right now, my partner and I are supporting her in the virtual classroom, but it's highly unsustainable in our circumstance because we're both frontline providers. I'm in pediatric intensive care in Milwaukee, and my partner is in pediatric intensive care at American Family Children's Hospital. And so, you know, we're really looking for supports and services that are normally in place for her. We understand, of course, that the spring was an emergency, but we really feel like she deserves to learn. And we're really, you know, in the process of rebuilding our network and trying to understand the priorities of the team, but also very concerned about her getting comparable supports and services to what are in her existing IEP, and kind of what that looks like in the virtual environment. And if it cannot be provided in the virtual environment, you know, hoping that she can receive in-person supports and services just to get access to the classroom. In her case, she has very significant fine motor delay. And so unlike the typical classroom environment, where I would say she does not require one-to-one support, in the virtual environment, just to click between windows and turn her device on, input passwords, things of that nature that are not a requirement in the general education classroom typically, require one-to-one assistance. And so she does require one-to-one assistance in the virtual classroom. And then of course the scaffolds and supports that she typically needs. And we really don't have any of that right now. So we're quite concerned.
I think you bring up an interesting topic that Daniel did too, around the technology. And I think that that's one thing that people forget about, and that is a big discussion of the IEP. But for kids who maybe that was never something you even had to consider, that really that is a huge stumbling block. And I think when you and I talked, you talked about your other child who is younger and can get on and access and do all the things with very little support, but really you're hand over hand almost in the home, and it's not sustainable, right?
Yeah.
And I think Daniel brought that up too, is there can be new considerations that you never had. And so, you know,
yeah, I think in this case, certainly a totally different scenario, and really Whitefish Bay, as folks may know, is really a low-tech district. She had never been exposed to a Chromebook or anything like that. We used an IEP in the spring, and she has a Chromebook now, so the transition in technology. She's actually always had an assistive technology communication device that she's used, but it was an iPad, on an iPad. And currently we don't even have access to that assistive technology. The district is still working through getting her access to that kind of technology. And she also in the classroom typically uses a phonic ear and to help with her auditory processing disorder. And they haven't been able to come up with a solution for the virtual classroom.
And I think to your situation, and just for other parents or people who might be watching, is, you know, that that added stress that you guys moved. So now you're in this position of having a brand new IEP. And so I think that's why we wanted to have you come on, because that is kind of a very different situation, but not, I mean, it happens. People move, you know, people definitely move. So, you know, I think you are very wise, you know those resources, and you're going to get what you need. But we really appreciate you coming on to share your story. We are just very happy that everyone joined us today. We're really up against that noon hour, which we try to get to, but it was all great information. We will post this on our Facebook page, the recording, and we also post it on our BPDD YouTube channel. And we will share all those resources that have been shared in the Zoom from DPI and DRW. So look for that on our Facebook page. And next week, we're gonna tackle the topic of supported decision-making. So we're gonna talk about alternatives to guardianship. We're gonna have another DRW person joining us, an attorney from DRW, another attorney from up north who's also a parent, and another parent who is using a supported decision-making agreement. So we appreciate all your time, and look for us next week, same time, 11 o'clock on the Zoom and Facebook Live.